Well, hello, everybody. Welcome again to our Start or Sit podcast. We're talking about previous week's injuries in the NFL and whether or not that player will play this week going into Week 16. Dr. Hawkins is here with us. How are you?
Hey, I'm doing wonderful. Getting excited for the holiday season, but it's already right on top of us.
I know it happened fast. I just I feel like I just got my tree down just like 2 weeks ago. Now I'm putting another one up, so it goes by fast. I'm looking forward to 2023. I want to look to the future of possibilities. We're getting through 2022 here, but I'm hoping 2023 is going to be a great year for everybody listening, and including you, Dr. Hawkins. So here we go. Are we ready?
Absolutely.
First one out of the chute. Big name here. Jalen Hurts, Eagles QB, right shoulder sprain. Sounds like he is pretty banged up. What do you think?
Yeah, if everybody saw the action this past weekend, he's basically been running a lot for the Eagles, and he was kind of cutting forward and had a defensive lineman catch up with him and kind of pancake him into the ground onto his right shoulder. So he was able to continue, but what they diagnosed him with after the game was a grade 1, maybe a grade 2 AC separation. So that's that attachment with the collarbone to the shoulder blade. And generally, it depends on the position of the player and which side they use. So obviously he's a quarterback and he's right-handed.
Yep.
So it's a tough situation where they're in the driver's seat with regards to their playoffs. So it's probably going to be a decision from a team perspective to lean on his backup, which I know you're a big fan of his backup,
yeah.
Gardner Minshew.
Absolutely. Mustache Man. Mustache Man is in the game.
Yep, exactly. So Jalen will be a sit. The good news is that type of an injury, if he gets the appropriate amount of rest, I think he'll be back for the playoffs, and it'll give Minshew a good opportunity to get his mustache army out there behind him.
There you go. Gardner Minshew. I mean, you ever get a chance to look at that guy's story and how he found his way to WSU with Coach Mike Leach, RIP Coach Leach, but he led the nation in passing, and Leach told him he was going to do that. Gardner Minshew starting for the Eagles. Jalen Hurts is a sit this week. They're in the playoffs already, so I'm sure they're preparing for Jalen to get back. You think that's going to be a week or two out for Jalen most likely?
Yeah, I think he's the kind of guy. He's come back pretty well from sprains and strain injuries in the past. So I think I think they're going to want him to stay fresh with regards to his plays. So I think he'll be back after 1 week, and so he gets some reps in with the team. I don't think they're going to be inclined to sit him long term and have him be rusty heading into the playoffs.
Okay, all right, there you go. Jonathan Taylor, running back, Colts. This guy is a great performer. Love watching this guy run the ball. The Colts just got beat, had a tough loss. It was the greatest comeback in NFL history. The Vikings came back from 33 points down at halftime, I believe. But Jonathan Taylor has this thing that's been biting a lot of our players this season, is this high ankle sprain. It sounds like it's fairly significant. What do you know about Jonathan Taylor?
Yeah, just like you highlighted, Shannon, he's been in and out of things all season, trying to nurse the ankle along. He sat out earlier for a lot longer than we expected. And unfortunately, he came back and they've assessed that he just has too much damage with this high ankle sprain to allow him to continue. Obviously, the fact that they're not really having a great season and they're really playing for probably the top pick in the draft factors into that as well. So they've shut him down. He is on IR. So unfortunately, he's a big bell cow for a lot of the fantasy guys out there. So if they were hoping that they could get some yardage out of him for the end of the fantasy playoffs, you're out of luck. So he is on IR. Does not sound like surgery. They're just going to give him an extended amount of time to allow that soft tissue to heal.
Yeah, I don't know what's going on this season. It just seems like every week we talk about one or two of these high ankle sprains. Again, this is an ankle sprain higher up between the two bones in your lower leg. A lot of tissue trauma takes time. Cooper Kupp is one of those players that had this and actually is out, and he had that tightrope procedure done to repair it. So you think Jonathan Taylor's just going to rest? He's out for the rest of the season. Look forward to him coming back next season. Here we go. Devin Duvernay. He's a Ravens wide receiver. He's got a foot injury, and it sounds like he is also maybe they're shutting him down too. What's the thought there?
Yeah, so they're very thin in their receiving core, and they were really excited that he was starting to show the ability to have some production, maybe time it in with Lamar starting to get back from his injury. And unfortunately, he had an injury in practice, so it actually happened the first practice after the weekend. He went out, had some pain in his foot. They thought perhaps it was a sprain, and it turns out he has a fracture base of the fifth metatarsal.
Oh, wow.
So, yeah, now the good news is it doesn't sound like it is the stress type of an injury that was sort of building up gradually and then broke. It sounds like it's the acute injury. So those are usually similar to a sprain where instead of the ligament tearing, you pull off a small fleck of bone, essentially.
Yeah.
And so the good news is the propensity of those is that they'll heal. He probably does not need surgery with that sort of intramedullary screw put in, but it's about a 2-month healing process. So, even if they come back with Lamar returning perhaps and do well enough to get into the playoffs, his season's done, unfortunately.
Yeah. When you talk about that fracture, that's I think we've talked about these before. These are these avulsion fractures that occur, and so as long as it's non-displaced, so to speak, he's going to be okay. And will he be in a boot, immobilized, flow out, allow that to heal, and then they'll just progress him as he comes out of that?
Exactly. They'll take the stress off. A boot will keep it so he doesn't tilt or lean and cause that ligament to pull that little piece of bone away. So you're right. They'll probably make him non-weight bearing probably for 7 to 10 days in the boot and then allow him to progressively weight bear. And nowadays they'll probably put what's called a bone stimulator on him early on to kind of, supercharge those little bone cells to lay down some callus, which is early bone formation quicker. And sort of get it going. I
know sometimes in those metatarsals, particularly that fifth metatarsal, I know I've seen patients that have struggled for bone healing, particularly if it's the fracture seems to be in the shaft of the bone, but if it's closer to the joint, a little better opportunity for healing there.
Absolutely. Much better blood supply. So as you get up into the thicker part of the bone, which is closer to the ankle joint, there's much better blood supply. Those shaft injuries, you're traveling down sort of the barrel of the gun and you're ending up in an area where there's sort of what they call a watershed zone. So less blood coming from either end of the bone. And so the propensity to heal in those areas is much less. Yeah.
Good stuff. Here we go. Caleb Huntley, here's another season ender for this running back of the Falcons. I mean, he had an Achilles tendon injury, and it sounds like it's ruptured or torn or needs surgical intervention. It suffered that last week against the Saints.
He's a rookie running back for them. Again, somebody they were really looking forward to getting some time for him, even though their season isn't going great. He looked like he was going to move into the starting role, and he actually tore it in the game, and he actually had one of those injuries where he thought, hey, maybe I just strained something. So he actually went out in the next play and actually blocked somebody coming in on the quarterback there, and it was able to stop the guy, but said, wow, this is not right. And he came out of the game, and they diagnosed him with that rupture. So that's one of those injuries that will require surgery. There's some literature that says that you can potentially cast a person in with their foot down, try to bring the ends into apposition with each other, and then soft tissue healing can happen. But statistically a bit weaker and statistically a higher re-rupture rate. So generally for athletes, this is almost always fixed surgically so that it has better strength, better tension of the muscle tendon, so you have better return of power and that ability to do quick activity, sprinting and stuff like that.
Yeah, this tendon is an interesting tendon. It's very large, it's huge, and it's connected to some very powerful muscles, particularly in athletes when they're jumping and running and stopping and starting. When that thing ruptures, usually people around it can hear it. It can hear it. It's loud when it ruptures. I was playing pickup basketball several years ago, and one of the guys playing with us came down the court, stopped, and went to make a move, and it was like, bam, and he went down, and he ruptured his Achilles tendon right there. So he's going to have surgery. Was it Terrell Suggs that came back like in 6 months? This was like 3-4 years ago. He had an Achilles tendon repair and came back faster than they thought. Remember that?
Yeah. I do. You've got a great memory for those things. So, he was a bit of a guy that, again, athletically a freak. You think of like the Adrian Petersons that came back from ACL surgery really quick. So he did come back, and he was an edge rusher, a bull rusher too. And he came back and did really well afterwards. Some of the ways to repair this have gotten a bit less invasive. And I think in those situations where you can avoid scar tissue and you can allow that tissue to knit together well while you start to strengthen it, you're trying to get that perfect storm, that perfect situation where you regain strength at the same time that healing is reaching its apex. And so in those situations, some of especially these elite athletes, they can really succeed. It's hard for the average Joe like you or I to do it, but I should just speak to myself.
No. I mean, I'm right there with you. I'm happy to be in that category.
Yeah. No, but you're right. That was Terrell, who was coming back from that a few years ago.
Yeah, he came back fast. Again, I just when I think about these injuries, just talking to you as a surgeon, I think it's really important that our listeners understand. I mean, when you get in there and you look at those two ends of that Achilles tendon that's ruptured, frayed, there's probably bleeding and the tissue is maybe retracted a little bit. I mean, you're putting that tendon back, but you can't put it back too tight or you can't put it back too loose. I mean,
exactly.
How do you assess that? I mean, are you just trying to keep the foot in neutral because this is one of those surgeries I would imagine that you, as an orthopedic surgeon doing sports medicine, you would probably want to get to this surgery pretty quick before that tissue or that tendon becomes more retracted and tightened up or shortened. Is that fair to say?
Absolutely. Once you get that retraction, then you have to worry about bringing the ends together. It's going to be under too much tension. Mm-hmm. And so what a lot of doctors will do, both myself and Dr. Dugella, who works in my group, we will oftentimes, when the patient's having surgery done, they're prone, they're laying on their stomach, and you'll oftentimes actually have their other extremity in the operative field, so you can actually see like the resting position of their foot when what they're on their intact side is. So you can kind of assess, relatively speaking, what that right amount of tension is once you bring those ends together, and make that decision of, okay, you know what, can we overlap that tissue a little bit? Or should we not be doing that? Because when those ends rupture, you go in and it's not like a clean break. It doesn't look like somebody just clipped it with scissors. It looks like two ends of a mop. Yeah. And so those mop ends do not fit together perfectly. So you have to decide how much you're going to overlap those mop ends or scunch them up together when you bring the ends together with suture material.
Yeah, I'm only laughing because your description is fantastic. So, but he is out. Caleb Huntley for sure is out the rest of the season, and most likely keep an eye on him next season. Wide receiver, the Rams, Brett Skowronek here. I think that am I pronouncing that right? Skowronek?
Yeah, I think everybody just runs it together like one syllable. It makes it easier that way.
This guy caught the touchdown from Baker Mayfield like 2 weeks ago, didn't he, or something like that? And that comeback win.
Yeah. He kind of been in Cooper Kupp's shadow, obviously, but a very similar player, kind of good possession receiver across the middle. And in his situation, also a calf injury, but it appears he's simply that sort of gastrocnemius strain that we see sometimes. So he had an injury into the muscle itself, maybe a little bit where the muscle and tendon come together, the junction zone, but not one that was in the substance of the tendon itself that would require repair. So kind of like the idea of resting it and letting biology win over. He'll be out. He's not going to be able to come back quickly. This is usually a 4 to 6 week process, but he'll be in a boot, and they'll be avoiding surgery on him. And their season again is pretty done. So again, they're like the Colts. They're playing for their draft pick right now.
Yeah, exactly. They were Super Bowl champs last year. Isn't that amazing? Mm-hmm. In one season, what can change there? They break the record for worst follow-up season. I think it's a 6-10 record for your follow-up season from a Super Bowl. I think they're looking to beat that. I mean, that's why I like talking to you. I get my preparation for trivia night. Okay, yeah,
nice.
Good job. Lamar Jackson, he had a PCL. We talked about him maybe a couple weeks ago. He had a posterior cruciate ligament sprain. I think it was week 13. 13, something like that. He's been out, but they're talking about him coming back this week. Week 16, he's coming.
Yeah, I think that's why to touch on him today and to emphasize again how these PCL injuries are different than the ACL injuries. And, essentially once that player is able to show good strength in their lower extremity, have good control and start to regain proprioception, which for your physical therapy world is what we rely on as surgeons, you guys reteaching people how to jump and land, not just, their motion and everything else. It's that high level stuff that we need therapists for. And that's the kind of stuff that he seems to be meeting that. And it looks like he'll be back this week. So for those players out there in the fantasy world who need him and need, some numbers, the problem is he has not been producing as high as he did earlier in the season. But hopefully this will be a good situation both for fantasy players and for the Ravens as a team that he's back.
Yeah, I think the Ravens are still in the hunt. Are they? I think they're in the hunt for the wild card still. They're not out of it. They need some wins though. It looks like. Or when I saw the standings, I thought they were in the wild card, but might have missed that. Hey, that is our start or sit podcast for week 16. I should say going into week 16 as we wrap up here. Real quick, Dr. Hawkins, I have to ask you, I saw this morning in the paper, I don't know if you know much about this, but our favorite Tyler Lockett is out with a hand injury that requires surgery. Do you get a chance to do you know anything about that?
I don't know the exact specifics of it. I did hear he had the fracture, and I think originally, obviously, the thought was he didn't need surgery, and now they're discussing it. But again, I'm assuming it's one of those situations where he probably had a dislocation adjacent to the joint, and it may be one where there was enough separation that they said, hey, if we fix this piece back, it'll heal better, and maybe his recovery will be a bit quicker. Yeah,
good stuff. Dr. Hawkins, again, thank you for your time. Happy holidays, my friend, okay?
Absolutely, Shannon. Same to you and your family and everybody at work, okay?
All right. Take care. Bye now.